Hello everyone, thank you so much for the organizer of this conference. I am Mansour Alqahtani and I'm a PhD student at the University of Sydney. Today my talk will be on the investigation of acquisition time and reconstruction parameters on image quality for optimization of whole body SPECT CT, a phantom study. After a brief introduction, we'll go through the aim and the methodology used in this study. Then after that, we'll go through the findings and we'll finishing up with the conclusion. Starting with the introduction, whole body scintigraphy is the recommended diagnostic tool for the evaluation of bone metastasis and commonly used for many years. However, it suffers from relatively low specificity as it's usually encountered in the region of spine and other locations with poor anatomical resolution. Single photon imaging computed tomography is a three-dimensional acquisition method that has been gaining popularity to evaluate equifocal lesion and improving the anatomical localization. And these equifocal lesions can have degenerative, inflammatory, and infective disease, which exhibit increased tracer uptake that may mimic metastatic bone disease. Nowadays, whole body SPECT CT is a new additional to clinical nuclear medicine that stitch multiple consecutive bed positions together like whole body positron imaging computed tomography with a potential to replace whole body scintigraphy. As we can see in our recent published study, which is a systematic review and meta-analysis to demonstrate the diagnostic performance of whole body SPECT CT, there are many studies supported the clinical utility of whole body SPECT CT in evaluating bone metastasis and when examining suspicious or equifocal lesion using whole body scintigraphy. Also, there are many advantages of using this technique, which is whole body SPECT CT presents a better sensitivity and specificity as well. The workflow could reduce the patient's discomfort. Also, there is no need for patient repositioning as well as immediate image evaluation by the physicians. However, the acquisition time is a crucial factor which strongly influences the image quality and lesion visibility of whole body SPECT CT. Therefore, the aim of our study is to investigate the impact of acquisition time and reconstruction parameters on SPECT image quality with the ultimate aim of finding the shortest possible acquisition time for clinical whole body SPECT CT without compromising the image quality. Moving to the material, NEMA image quality measurements were performed on a SPECT CT imaging system, Symbia and T4, using a NEMA body phantom with different sphere size. As we can see here, the phantom NEMA body phantom used in this experiment, a sphere to background activity concentration ratio of technetium 9090M was 8.5 to 1. The phantom image was acquired with 15-second pair projections with total of 60 projections per detectors and a step and shoot mode with an uncircular orbit. The image data was simulated gating into 15 frames. Using gated technique means that the patient, or in this experiment, the phantom didn't receive any additional scanning time. So the gated acquisition image was acquired, and then each gated projection frame of the phantom acquisition was sampled into various frames corresponding to simulator shorter acquisition time. So we can see here summing of frame from 1 to 15 to create 15-second per view, and from 1 to 9 to create 9-second per view, 1 to 6 to create 6-second per view, and also summing 1 to 3 frames to create 3-second per view. The data were reconstructed by Hermes hybrid recon, using 3D iterative reconstruction order subset expectation maximization algorithm with resolution recovery, attenuation correction. Also, the scatter correction was applied using a Monte Carlo simulation technique. Different number of iterations were applied to find from 4 to 24 to find the optimum number of iterations with shorter acquisition time. Then after that, a Gaussian Bose filter fluid half maximum from 0 to 12 millimeter were applied. We end up with 96 images. The process of image analysis began with the selection of central slice through the middle of the hot spheres, as well as the selection of 4 axial slices, 2 in each direction relative to the middle slice. As we can see in figure A, the region of interest were drawn on each hot sphere. Circular arrow eyes with the same diameter as the sphere internal diameter were drawn, and subsequently arrow eyes of the identical size were drawn on the background in the phantom on central slice, as we can see in figure P. Similar sphere or smaller sphere from 28 to 10 millimeter were drawn concentrically to the ROIs of 37 millimeter, as we can see in figure C. So the total ROIs or the total 60 ROIs of every sphere were drawn on the background according to NEMA 2018 standard. Moving to the results, SPECT image was assessed by contrast recovery, background fiability, and contrast to noise ratio. The contrast recovery was calculated using first equation, so the mean pixel value on the ROI's photosphere divided by the mean pixel value in the background divided by R, which is the true activity concentration, the phantom to the true activity concentration in the background. The background fiability, the standard deviation divided by the mean pixel value in the background. Here in the figure, we can see the contrast recovery and background fiability as function of different number of iteration from 3 second per view in figure A to 15 second per view in figure D. The overall contrast recovery increase would increase the number of iteration at expense of high background fiability. Also, the contrast recovery increase when the diameter of a sphere increase as expected. Contrast recovery convergence achieved at 8 iteration, whereas at 12 iteration, the convergence displayed greater stability at all acquisition time, as we can see here in the top row. However, due to the awesome algorithms convergence at particular number of iteration, for example, with more than or equal 12 iteration, the uptake in the region remained about the same with less than 4% variation, but the noise level keep increased. Graph on the bottom displayed the background fiability, which is reflect the image noise level. The background fiability increase with increasing the number of iteration. In addition, a small sphere has higher noise than the larger sphere when the noise decreased when the acquisition time became longer. Moving to the table on the right side, which is demonstrate the background fiability at different number of different acquisition time. So in case of 37 millisphere, the image noise rose from 7.96 to 16.61 when the acquisition time increased from decreased from 15 second per view to 3 second per view. Also at smaller sphere, which is 10 millimeter, the noise level rose from 8.32 to 16.22 when the acquisition time decreased from 15 second per view to 3 second per view. So it must be noted that increase in number of iteration determine a significant increase in background fiability at shorter acquisition time. Another key observation revealed that shorter acquisition time were associated with increased contrast recovery, which could be attributed to that noise was amplified at shorter acquisition time. As we can see in figure A, with the largest sphere, the black line with 3 second per view has higher contrast recovery than 15 second per view, also with the smaller sphere. Similar result was obtained, which identified noise amplification at shorter acquisition time as the reason for the increased contrast compared to the real value. Clinically, detection of spheres of smaller size is most difficult, so the contrast to noise ratio with less than 5 according to the Rose criteria were used to assess how contrast to noise ratio improved as acquisition time increased. When a sphere's feasibility was analyzed, it was discovered that longer acquisition time at 9 and 6 and 15 second per view was associated with better contrast to noise ratio. And these findings indicated that all different spheres conformed to the Rose criteria at 9 and 15 second per view. However, with 3 and 6 second, the smallest sphere 13 and 9 millimeter were invisible at 3 second per view. The 13 sphere became visible at 6 second. So the 3 and 6 second per view acquisition time were associated with a significant decline in lesion identification with the smallest sphere, attesting to the fact that increase in noise level lowered lesion detection and therefore image quality. In this figure, we can see that the impact of different Gaussian filter from 0 fluid half maximum to 12 millimeter at different acquisition time. So at shorter acquisition time, the distortion of sphere shape took this form of an irregular star. At the same time, decreasing number of sphere could be observed at acquisition time decreased. The noise was not affected by the application of 0 and 4 full width half maximum filter. However, using a higher filter of 8mm Gaussian filter alongside slight blurring permit, but the artifact was mitigated. However, the image contrast is reduced. Also, by using a 12mm Gaussian filter, the Gibbs artifact also mitigated at 3 and 6 second per view. However, the contrast recovery is significantly reduced. Moving to the conclusion, optimization of reconstruction parameters is potentially useful to improve acquisition time for SPECT image. On the downside, noise level may be increased. Improvement in contrast to noise ratio and sphere shape was observed with the longer acquisition time, especially in the case of spheres of smaller size. We investigate the optimum number or optimum acquisition time and reconstruction parameters as follow: 9 second, 12 iteration, and 8mm Gaussian post filter. The findings of this phantom study can thus be seen as essential step toward the clinical study. This is the end of my talk, and thank you.